it's Dr. Megan from Balance Within PT. Today I want to talk about pain with sitting, specifically butt pain with sitting. I get a lot of patients that come in and they get this dull, toothache kind of feeling when they're sitting deep in their butt. And there's lots of factors that can contribute to this. With your pelvis, there's a lot of different things going on. So some possible scenarios can be tightness in your pelvic floor, so all these muscles in the bottom of your pelvis or around your hip can be really tight and compressed, and that can contribute to pain. There's also nerves that go through this area, and that they can be getting some compression, and that can also be contributing to some of that. Even the position of your pelvis, how it's sitting, how it is when the surface you're sitting in, or even the position of your femur in the socket, so that leg bone, how it sits in the socket can make a big difference as well too. Now there are lots of other factors too, and we want to look at all of those things to see might be contributing to it, but those are kind of some of the big players with that. But I want to give you a few tips today that you can try if you have to sit. Maybe you have to sit for your job, or you're sitting on a computer, maybe you have a hardship coming up that you're getting that pain with, and see if this can give you a little bit of relief. So the first thing is, you want to make sure when you're sitting that your hips are higher than your knees. So you want to be at a slight angled down. This just tips your pelvis a little bit to put a little bit of pressure off of some of those deep muscles and nerves in that area. So if you're able to tip your seat forward a little bit, that can be helpful. Number two, this one's going to feel a little weird, but can give you instant relief. So you want to think about spreading your sit bones apart, and you can actually just take a cheek, kind of spread it apart, shift over, take that other cheek, spread it apart, so you're just kind of opening that space in your pelvis and letting that pelvic floor just kind of stretch out a little bit. Oftentimes this can give people relief right away. And then the third tip is a little stretch you can try. So bringing your ankle towards your opposite knee, and then if it feels good, you can kind of push that knee down just a little bit too, or lean forward just a little bit. The goal of this is to get a nice, comfortable stretch in your back, so not any kind of pinching in the front. And you can hold this from 30 seconds to even up to a couple minutes to really get those tissues to stretch out, if it feels comfortable to do that. Finally, the last thing I would think about is, are you a clencher? So I see a lot of people get in this kind of tucked position and clench their glutes throughout the day. It can be kind of a subconscious tension holding pattern. So if you're one of those people, I want you to become aware of it and see if you can just let those muscles go a little bit. There's no need to be clenching those glutes throughout the day, and that can contribute to a lot of the things that can cause pain with sitting as well too. So I hope that these tips were helpful. I hope you can give them a try and they can give you a little bit of relief. I would encourage you to check out our website at balancewithinpt.com if you're looking for more tips or tricks, or give us a call to see if we can help you out if you're having some stubborn pain with sitting. Thank you.